Hello, my name is Kyle Deacon and I'm a fourth year medical student. Today I'm going to be talking about Friedreich's ataxia. I've created a series of videos in order to go over what Friedreich's ataxia is for non-medical professionals, whether those be patients or their families or anyone who else who is interested in the disease. I have several goals in mind for this series of videos. The first is overall understanding what the disease is, as well as its treatments, and then in the long term looking at what future research and treatments might be available. Next, I just want to emphasize that while this video will be covering a broad array of issues involving the disease, it doesn't replace the advice or the consults that you get from your physician or the rest of your healthcare team. Finally, I just want to advise that because this is a disease that affects children, many pediatric patients, that I recommend that parents watch this video first, as there may be some sensitive topics going over, and parents should decide for themselves whether this is something that they want their children to be seeing. Thank you. At this time of our overview, I'd like to start by talking a little bit about the history of the disease before going on to talk about symptoms. First of all, the disease has probably been around and affected people for many, many years, but it was first really studied back in the 1860s by Dr. Nikolaus Friedreich in Germany, hence the name Friedreich's ataxia. It primarily affects the nervous system. However, it does affect several other systems as well. And today we understand that the cause of the disease is ultimately genetic. It's encoded in the DNA, which makes most treatments difficult, but also offers some hope for future treatments as well, something that we'll be talking about at the end of this series of videos. Next, I'd like to go into a little bit more about the name. We know it's called Friedreich's because of who discovered it, or really, honestly, first studied it. But why is it called ataxia? It's not a name or a word that we hear typically in day-to-day speak, but it's often confused with dizziness. Dizziness, however, is more about sensation and the way we perceive things like room spinning or vertigo, you may understand. However, ataxia really has to do more with discoordination. Think about things like trying to flip a coin and catching it, or being able to walk in a straight line with your feet right in front of the other. That really more describes ataxia. Other things that cause ataxia on a much more common basis are things like alcohol, the discoordination that people feel when they've had too much to drink, or sometimes we see it in older people who have a little bit more trouble staying steady, hence the need to shuffle a little bit more when they walk. Those are some of the more common causes of ataxia. However, with Friedreich's ataxia, we're looking more specifically at how it affects the nervous system. Other systems that it involves include the heart and the pancreas, although usually patients don't have as much difficulty with those symptoms until much later after the disease is originally identified. The ataxia itself, however, is often first identified approximately the age 5 to 20. It varies significantly from individual to individual. Now that we've learned a little bit more about the history of the disease, I'd like us to talk a little bit about what actually seems to cause it. Sometimes genetics can seem to be a very intimidating process, and it certainly is. But when we break it down into the most important parts, I hope that we'll be able to see what actually happens. In the human body, we encode in our DNA essentially instructions to make a protein which helps control a lot of the systems involved in controlling energy within our cells. Without this protein, we won't be able to properly regulate how that energy works, which is why we really require the blueprints that we have in our DNA for these instructions to work properly. Normally, we have something called the FXN gene encoded in our DNA. The cell then takes these blueprints in our DNA and makes the protein known as frataxin, which is, of course, named after Friedreich. This protein, to be honest, we don't have 100% understanding of exactly what role it plays in the cell, but we have a pretty good sense that it's involved in the cell's energy regulation. How it exactly does that is a little bit beyond the scope of today, but essentially it helps make sure that the cell can use its energy appropriately for all the different purposes that it may have to keep the body working normally. So when this works properly, our DNA shows us what to do. The cell takes that DNA as a blueprint in order to create the frataxin protein. then that protein does proper cellular energy regulation and we have normal function within the various systems in the body. But what happens in the case with Friedreich's ataxia? Well, we have two copies of DNA, often used as backup for each other. If you have an error only in one of those copies, usually you can be fine because the copy that works appropriately will continue to produce enough protein to make things work well enough. However, if there is an error in both copies of that DNA, the blueprint doesn't work properly. And ultimately, the cells that look at that DNA can't use them well enough to make enough protein. So they try and create the proper protein for taxin, but they really just can't handle it with this improper instructions they have, and you create too little of our protein for taxin instead of the big amount that we really want. Once that happens, without the proper amount of frataxin, the cell doesn't really have the right tools in its handbag in order to have good energy regulation. As a result of that, various tissues in the body have trouble working properly and you end up with our symptoms. This is especially true in tissues that require a lot of energy, such as the nervous system, the brain, the different nerves, the heart, as well as the pancreas that we talked about. These different tissues require a lot of energy, which seems to be why they're adversely affected the most by not having enough of the frataxin as a result of the error in the genes. So before we go on to our next video, where we're going to go more into depth about the symptoms and treatments for this disease, I want to do a very brief review. We know that the disease is genetic. It's caused by an error in our DNA, which has the blueprints in order to create the protein frataxin, which helps us with our energy regulation in our cells. As a result of it being genetic disease, it is inheritable, where it can be passed down from parents to children. However, it is not transmissible, something like an infectious disease like COVID or the flu, where you could give it to somebody else. The systems that it mostly affects are the nervous system, the heart, the pancreas, and to some extent in some patients, the skeletal system as well. These symptoms are treatable. Currently, there's no cure for the disease, but research is ongoing, especially looking at genetic options where we could potentially affect the underlying genetic issues that cause the lack of the protein.